All right, so I told you that today would be a little bit different. Today, instead, we finished chapter 7 already. So we've really gone over all of the bones of the skeleton, the major bones of the skeleton. And so what I'm going to do with you today is I'm going to walk you through all of these bones and bone markings that are in your lab for this week. So this week's lab is by far the hardest. It also happens to be the most difficult lab in a face-to-face class as well. There are a lot of bones and bone markings. So what is a bone marking? You know, you might be thinking to yourself, I have no idea what that is. So a bone marking is a hole or a projection. And I'm going to grab some paper and write this down. I'm afraid to leave my document camera because I'm afraid I won't be able to get back to it. So I'm just going to old school write on some paper. All right, so a bone marking we either have, for a bone marking, we either have projections. These are things that stick off of the bone, right? So projection, it's something that's projecting off the bone. A lot of times we might call these processes. You might see that term with a bone marking. And these can be there for one of two reasons. So one reason why you might have a projection is because you have big, heavy muscles that are attaching at that point. The other reason why you might have a projection, something growing away from the bone, is because at that point you are forming a joint, okay? So I'm going to show you some examples real quick. Okay, so I have the skull right here, okay? And so on the skull, I have two examples of projections that are really close to each other. So this one right here, you can kind of see it sticking down. This is one that you can feel actually behind your ear. So you can see this hole right here. That's your ear canal. And so this projection, if you kind of feel right behind your earlobe, you'll kind of feel this big knot back there. This is there because you have a big muscle in your neck that attaches here, and it helps you turn your head side to side. And so this is here because you've got a big muscle that's constantly pulling on it, causing the bone to grow away from itself. Now, I told you the other reason why you can have a projection is because you form a joint. And so if you look right here on the mandible, right, so do you see this big projection right here? This is here because you can see it's actually forming a joint. So it's forming a joint with that temporal bone where those two bones are coming together. So you'll have a projection because big muscles attach or because you're forming a joint at that location. The other type of bone markings that we have are holes or grooves. And these are here always for one reason. These just allow things to pass. So they're basically passageways. They're allowing blood vessels and nerves to pass if they're a hole. If it's a groove, it's allowing big muscles to sit in that location, okay? So as we go over all of these bones and bone markings today, just kind of keep that in mind, that you're either gonna have this thing that we're talking about because it's a projection and you've got heavy muscles attaching or you're forming a joint, or it's a hole or a groove and it's allowing the passage of something, okay? So I told you that I am not going to go over the lab PDF with you today. We will do that next Monday like normal. But what I am going to do with you is I am going to walk through all of these structures that you have to know using the images from your textbook. And the reason I'm doing that is because I'm going to use these images for your lab quiz. I'm also going to be using these images for your lab exam. So as you study, it is best to study the images from your book. Okay, now your lab PDF, obviously you have to fill it in. That is your lab work for this week, and it will be very helpful in terms of learning and finding these structures. but I would study the images in your textbook. Okay, so you should all either have the e-text or the hardback version of this book. If you have the e-text, there are some little tools in the e-text that allow you to highlight. So you can do exactly what I'm doing and you can highlight. Now you'll notice here that I have two different color highlighters. I have blue and I have yellow. I did this for a reason. I did blue. If it's highlighted in blue, it's a bone. So blue for bone. If it's highlighted in yellow, it is a bone marking. Okay, so a lot of times students have a hard time and they ask me, well, how do I know the difference between a bone and a bone marking? Well, now you know. If it's highlighted in blue, it's a bone. If it's in yellow, it's a bone marking. Okay, so we're going to start in the axial skeleton today. We're going to go through the skull, the vertebrae, the ribs, and the sternum, and then we'll do the appendicular skeleton. So we'll do shoulders, arms, hips, and legs. Okay, so the skull, I told you on Monday, is the most complex bony structure, right? It has a ton of bone and bone markings in it. This is a frontal view of the skull. And so you may want to highlight everything that I've highlighted because those are the structures you are responsible for knowing. Okay, so it makes it really helpful as you're studying if you've highlighted what you need to know. So I'm going to walk you through the bones first that are highlighted in blue. Now the bone, like the frontal bone over here, it is everything in yellow. So this is basically your forehead bone. The parietal bone is this sort of red color on the side. And that sort of sits on the side. The nasal bone is this one that's in purple here. Now the sphenoid bone, from the front, you can see the sphenoid bone here. It's in pink in the back. But if we look inside the brain, inside the cranial cavity, we'll see it again from a different view. The temporal bone is the temples. It's on the side, so it's kind of that orangey color. The ethmoid bone, again, we can see this from inside the cranial cavity, but you can see it right here. It is in green. It's that grass green color. Oh, sorry, it's the orange color. That's our ethmoid bone. It's the orange one. The lacrimal bone is the grass green color. The zygomatic bone is this blue bone. This is kind of what you think of when you think of your cheekbones. The maxilla is this lighter purple color. It's all of this. And then the mandible is down here in this sort of burnt orange color. And then the last bone is over here is the bomber bone. It is this little bone. If you're looking inside the nose, it's this bone right here. Again, from a different angle, we see it a little bit better. So we'll see it again on the next page. So those are just the bones of the skull. We went over these in the lecture on Monday. So now what I want to do is go over the bone markings. Now, in terms of bone markings, pay attention to the name because a lot of times the name can tell you a lot about the location of the bone marking. So this very first one, the supraorbital foramen. Think of the term supra. It means above. Your orbital is your eye socket. So a foramen is a hole. So you have a hole above the eye socket, okay? You have one on both sides. Now the supraorbital margin is essentially this ridge of bone right at the top of the eye socket. You can feel this on yourself. It's usually right below your eyebrow. The optic canal, you'll see it in the skull. It is a hole in the very back of the orbital, and it is allowing the optic nerve to pass from the eyeball all the way back to the brain. In the inferior orbital fissure, a fissure is not a hole, but it's actually sort of like a canal. It's like a wider hole. And so you can see this fissure down here. This is our inferior orbital fissure. Now we move down in here and notice that these next two bone markings are in the ethmoid bone. Okay, the ethmoid bone, you can see it from here. It's this orange color. You can also see it up in here in the eye socket. Now notice that these both are in the ethmoid bone. You have something called the middle nasal concha. You actually have folds inside of your nasal cavity. And these folds do a lot of things. One is they increase the surface area of your nasal cavity. So that's helpful because when you're breathing in air, it passes through your nose first, and having a greater surface area means that you have a better ability to clean that air in the nasal cavity. So you have this area that's lined with mucus and nasal hairs. So that's what the middle nasal concha are. You can see them on both sides. And then this structure called the perpendicular plate, it's right down the middle. So this is sort of like a separation between the right and left side of the nasal cavity. Now you may have heard of people having a deviated septum. So the septum is not the same thing as the perpendicular plate. The septum is actually soft tissue. You can actually get a hole in the septum, a perforation in there from sometimes medications like Flonase. That's an issue. People that take Flonase can sometimes get a hole in the septum. If you snort cocaine, hopefully you don't, but if you do, you can get a hole in your septum. Again, that's different. That's not getting a hole in the bone. The bone is the perpendicular plate. And then we also have folds on the bottom down here. They're in green. Those are called the inferior nasal concha. Okay, so those are the bone markings over here on the right side that you can see. On the left side, I have two that are highlighted. One is the infraorbital foramen, right? So we already did the supraorbital foramen up here. The infraorbital foramen, infra just means below. So it's the hole below. Now these two holes, the supraorbital and the infraorbital foramen, these are here because they are allowing nerves to actually pass out into your face. So these are nerves that are going to help go to the muscles of the face. So they help with facial expression. They are also nerves that are going to pick up sensation from your face. So if somebody touches your face, you'll feel it. So that's what those holes are for. Same thing down here at the bottom. We call these the mental foramen. Now remember, this one should be kind of easy. Remember, this area, your chin, is called the mental region. So that should make it a little bit easier for you to remember the mental foramen. Again, I always think of the thinking man. You know, put your hand on your chin when you're thinking, and thinking is a mental process. And again, these holes are allowing blood vessels and nerves to pass. Now this image down here in the bottom right, oh, you know what? I didn't even tell y'all what page I'm on. Were y'all able to find me? That was terrible. I just jumped right in. We are on, in the hardback version, we are on page 203. I don't know. I think the e-text might be a slightly different page. Does anyone know what page we're on in the e-text? Nobody's using the e-text?
Is chapter 7.1?
It's 7.1. It doesn't give you a page number though?
I didn't scroll to the bottom. Just like, it's easy to find once you get on that chapter.
Okay.
201.
Oh, did you say 201?
No, 7.1.
7.1, okay. All right. This image down here in the bottom right, this is looking at the skull from the back. So you're like looking at the back of somebody's head. And so really the point of showing you this image is just so you can get familiar with those different bones again. Now remember, from the front, we have our frontal bone, and on the sides of that in this red color are the parietal bones. You can see them a little better here from the back. So you see those parietal bones, and they come together in the middle. We call where they come together, and we see this really well in our skull. Where your skull bones have fused together, that's called a suture. And it truly looks like you've stitched your bones together. So I don't have the top, I don't have all the cranial bones on the skull, but you can really see very well on this skull, you can see these sutures here. So it's just where those bones, and I'll turn this one to the back, like what you're looking at, you can see where those bones have fused together, okay? And so the parietal bones come together at the midline. This runs right down the middle of your skull. This area is called the sagittal suture. This one should be easy to remember because remember, when you cut something down the middle, it's a sagittal cut. Okay, so sagittal suture. This bone in the back here, this is the lambdoid. Oh, sorry, this is the occipital bone here. And I did not highlight this one, but I'm going to. This suture right here that separates the occipital bone from the parietal bones is called the lambdoid suture. So I'll highlight that one in yellow. That's a bone marking. Okay. All right, so let's go on to the next page. Okay, so this page is still looking at the skull, but now we're looking at it from a lateral view. And so again, you know, I've highlighted in blue all of the bones, so you may want to go ahead and copy that. Again, we've got our frontal bone here. I didn't highlight it, but you should know the frontal bone. We have the parietal bone on the side. We have the occipital bone in the back. We have the temporal bone. Think of your temples. Now, in this case, from the side, we can see this bright pink. This is that sphenoid bone, which remember, I'm going to flip back to this picture. Remember from the orbitals, we can also see that sphenoid bone. Okay, so that's our sphenoid bone. This is your cheekbone. This is the zygomatic bone. Okay, we have our nasal bone and that purple, that dark purple, the maxilla bone and that lighter purple. And then in that burnt orange at the bottom is our mandible. Okay, so those are our bones. Now let's do the bone markings that we can really see from the side view. So the first one that I have up here is called the coronal suture. Remember, a suture is where the bones fuse together. This one, I remember a couple of ways. One, remember a cut that cuts you into a front half and a back half. I typically call that a frontal cut, but you can also call it a coronal cut. And so coronal suture makes sense. It's cutting into a front half and a back half. The other way, the way that I actually remember this, is I think of the term coronal and I think coronation. Now, you may not know what a coronation is. I know what it is because when my son was little, he loved the movie Frozen. And in Frozen, there's like when Anna wakes up one morning and she's super excited and she's like, it's coronation day. It's coronation day. She's really excited. A coronation is a crowning. And so when you wear a crown, you would wear a crown right there, right on the middle. So I remember coronation, crown, coronal. So this next suture right here is called the squamous suture. So this one is going to separate the temporal bone from the parietal bone. That's right here. And then again, I showed you this one already. This is the lambdoid suture. This is in the back, separating the occipital from the parietal bones. Okay, so now I'm going to walk you through this one, the zygomatic process. So the zygomatic process, you can see right here. The term process means a projection. It's something sticking off the bone. Now remember, this bone that's in orange is the temporal bone. But this part that's coming off the temporal bone is called the zygomatic process. So the reason we call that the zygomatic process is because it's this big projection that's coming up and forming a joint with the zygomatic bone. Okay, so that's the zygomatic process. The hole right here is called the external acoustic meatus. Now that one should be easy because it has the word acoustic in it, which means sound, right? So this is basically your ear canal. Now I mentioned the mastoid process. The mastoid process is this sucker right here, this big projection. Again, process means something that's a projection. This is here because you've got big neck muscles attaching to this. The styloid process, it is this one right here. It's in orange, and it's this really skinny, sharp, pointy structure. The styloid process, how I remember that one is, to me, it looks like a pen, like it's really sharp and pointy. So I think of the term stylus. So styloid, stylus, right? This is also here for muscles attachment. You actually have some muscles that connect to your tongue that go from the tongue back to the styloid process, and they actually help you move your tongue around your mouth. This one right here called the condylar process. That's what we call it in the textbook. In your lab PDF, we call it the mandibular condyle. And that's this right here. It's where the mandible connects into the temporal bone. So it's forming a joint. It's a big process there to form a joint. So I call it, again, I call it the mandibular condyle. And that one makes sense. Mandibular condyle. It's the mandible. And the term condyle, it's a process. But I always remember this term because you're going to see this term again as we go throughout our bone markings. I always remember a condyle comes in contact with another bone. So the reason we call this the mandibular condyle is because it's forming a joint. It's coming in contact with the temporal bone. Okay, we also have up here, we have another projection on the mandible kind of in the front called the coronoid process. It's not forming a joint. It is there because you have muscles connecting to it. These are the muscles that help you raise your jaw. So they're connected here at this coronoid process, and they pull your jaw shut. We already did the mental foramen, but you can see them again, these little holes in the mandible that allow blood vessels and nerves to pass. And then the last one right here, the lacrimal fossa. This is a hole, so a fossa and a foramen are very similar, okay? This is a hole in the lacrimal bone. Remember, the lacrimal bone is this sort of grass. And so the lacrimal fossa is a little hole that actually is your tear duct. So it will drain the liquid from your eyes, the tears from your eyes. It actually drains it down into the nasal cavity. So this is why when you cry, your nose runs. And that's just because tears are actually draining down into the nasal cavity. A lot of times people that have watery eyes, it's because their tear duct is blocked. So sometimes they'll have to do surgery where they'll insert like a little wire to pop open that tear duct again. Sometimes they'll actually have to put in like a synthetic tube to hold open that tear duct so it can continue to drain. Okay, but it's moving through that lacrimal fossa. Now you have, in your textbook, they do a really good job of showing you these sort of artist renderings, and then underneath are the actual skulls. I am only going to do, on your quiz and on your lab exam, I'm only going to be using these pictures that we're going over. Okay, so that should make your life a little bit easier. All right, so we're going to skip over to the next page. In your textbook, it's page 206. Now we're still on the skull. Skull is going to have the most of these markings on it. This is looking at the skull from the underside. Now you can tell because you see teeth right here. And so I have a skull right here. This poor guy's missing lots of teeth. But if you take this skull, the mandible has already been removed. If you take this skull and just turn it this way, right? We're looking at this from the underside. Again, you can see those teeth. Okay, so just to orient you, what you're looking at. And so what we have here is I have only labeled a couple of things here. Now, some of these you already know, right? Some of these like the temporal bone, the parietal bones, you should know those. But what I highlighted are the ones I'll ask from this view, okay? So from this view, you can see in blue, we don't have a lot of bones that I'll be asking you from this view. We do have, in brown, we have our occipital bone. Again, this is sort of the back of the skull. It kind of goes underneath and forms that underside as well. Now we can see our vomer bone a little bit better. So here's the vomer bone. It's this pretty blue color. I'm going to skip back and remind you, okay, here. Remember, we can also see the vomer bone in the nose, just right here, just barely. But if we take the jaw off and we look now under the skull from this view, we can see more of that vomer bone. Okay, if we go through these little holes, we're out into the nasal cavity. The other bones here, this is the maxilla bone, right? This is that pretty purple color, that light purple, that we also find right here. So the maxilla bone dips under those top teeth and forms the first part of your hard palate. Okay, so there's our maxilla bone. And then this bone right behind the maxilla bone that's kind of this taupey color, this is the parietal bone. Oh, that's not the parietal bone, I'm sorry. It's the palatine bone. That one makes sense. Think palate, hard palate. So that's the palatine bone. All right, so now let's go over your bone markings, which are in yellow on here. So in the maxilla bone, we call this area the palatine process of the maxilla bone. Again, think of a process. It is a projection. And so this is here because it is coming down and sort of projecting backward, forming that hard palate. And it's forming a joint with another bone, the palatine bone. Okay, so I know that sometimes can get kind of confusing. Just remember you have two different bones here, maxilla bone, palatine bone. But this part of the maxilla bone is called the palatine process, connecting to the palatine bone. Okay, now I'm also going to walk you through the structures that are here. Okay, so this one right here, I know it's kind of hard to see, so I'm going to show it to you also on my skull that I have. But this is called the mandibular fossa. Mandibular fossa. The mandibular fossa is what the mandible sits in. So I'm going to use this skull here. Okay, so it's kind of the same angle that you're looking at. And this right here, I'll put my fingers in it. This is the mandibular fossa. If I turn it to the side, maybe you can see it a little better. The fossa, it's a big divot, okay? You can see that where my fingers are. And the reason we call this the mandibular fossa is because that is what the mandible sits in. Remember, we call this the mandibular condyle, sitting in the mandibular fossa, okay? So that's our mandibular fossa. The styloid process, it is really hard to see from this angle, but I did go ahead and label it. It is that sharp, pointy looking structure. It holds muscles that are coming from your tongue. Remember, styloid, stylus. Okay, again, from the skull, if I turn it this way and I put my fingers here, now you can see it, right? It's kind of sharp and pointy. And then we also have our mastoid process. And again, I've mentioned this one a couple of times. The mastoid process is this structure here on the side. If I turn it to the side, you see it a little bit better. And this is connecting that neck muscle that helps you turn your head side to side. Now we're going to go over here on the right side and go through these holes. The way that I'm going to go through these holes, I'll write it down for you. So I have a little saying. It literally makes no sense, and I guess it's not even a saying. I think of the word Jclo, J-E-L-L-O, and I remember J-C-L-O. Literally makes no sense. But for some reason, I always just think J-C-L-O. And I just remember, I always think Jclo, J-C-L-O. I know it doesn't spell Jclo. If y'all have another way to remember this, great. That is how I remember it. And so I'm giving you this little acronym right here, so that as we go over these holes, the first letter of each one of them is the name of those holes, okay? So I'm actually going to start with this big one right here. This big one is not one of the JCLOs. This big one is sort of our landmark. The big one is called the Foramen Magnum. You know foramen means hole. Magnum means big. This is a big hole. There's only one of them, right? We can look the actual skull. You can see that big foramen magnum. What runs through that? Remember, holes are there for things to pass through. So what's passing through the foramen magnum? Nobody? The spinal cord. The spinal cord runs through the foramen magnum, so it's running from the brain down through this hole, this big hole, okay? Now, from there, if we go up, we have these sort of flat areas right here. These flat areas right next to the foramen magnum are called the occipital condyle. Remember, the term condyle means to come in contact. Condyle, contact. These are here. I'll show them to you on the skull. There are these flat areas right here. These are here because the very first vertebrae is going to sit right on top of those. Okay, so it's going to come in contact with another bone. So that's the occipital condyle. All right, so now we're going to get into the other holes that are listed right here. So again, this is where the JCLO comes into play, okay? So how I remember these, JCLO, is you start here at this foramen magnum, and all of the holes, the JCLO holes, they are one on the right, one on the left. So they're paired, okay? And so we essentially are just going to come, I'm going to draw in here, we're going to come up and out. So up towards the middle and out. Up towards the middle and out. So the first one we're going to start with on either side of the foramen magnum is the jugular foramen. That's our J. The jugular foramen is actually pretty big, and obviously it is there because it allows the jugular to pass. Okay, so if I show you this on the actual skull, you can see if I tip it a little bit, you can see the jugular foramen in here on the side. So you can see those. I'll try to see if I can put my finger in there. Here's one, and here's the other one, right? So the jugular vein is a huge vein that's draining your head. So that hole is really big. So that's our J. Okay, now we're going to walk up. Okay, we're walking up towards the midline and out. So the next one is C. That's our carotid canal. Carotid canal. And that one is there because it allows the carotid artery to pass. This is also a big canal. And the carotid artery is actually a very large artery that is supplying blood to your brain. So if we look at the skull here, you can see, I'll see if I can, my pen is closed here. It is this one right here, and it is right in front of the jugular. So it's very, very round, right in front of the jugular, right there. Okay, so now if I tip it, here's that jugular back here, and then here you can see that carotid. Okay. So JC, we're walking our way up towards the midline. In the middle right here on either side, that's our L. That's the foramen lacerum. Again, this is allowing blood vessels and nerves to pass. So J, C, L, and then the last one, O. We move to the outside. It's a really small one called the foramen ovale, and it is truly shaped like an oval. Okay, so if we go here, we have our J, our jugular. We have the carotid. We have the lacerum, foramen lacerum. And then on the outside, foramen ovale. Okay, so we just kind of walk our way up towards the middle and out. So those are the holes on the underside of the skull. So hopefully that helps, Jclo, helps to orient you and helps you remember those. The only one that I did not cover with you is this one right here, the stylomastoid foramen. This is a hole that gets its name because it's a hole that's situated right between the styloid process and the mastoid process. And so I'm going to show it here. It's kind of hard to see on here. I mean, you can see the hole. It's really small. I'm going to use this skull. It looks better on this one. So if I show you this skull kind of from the side, again, you can see my finger under there. You can see the mastoid process, and then you see that styloid process. And if I rotate it a little bit, now you can see that hole that's in that hole right there that's in between the two. So it's in between the mastoid and the styloid process. So the stylomastoid foramen. Okay. The last view of the skull that we have is on the next page. And this is looking at the skull from where the brain sits. So if we take off those cranial bones, right? So if we're looking at it like this, we take off the cranial bones. They're already removed here. That's this way. And sit it down. Now you're looking at where the brain actually sits, right? In the skull would sit in here. So this is what we're looking at. We're looking at sort of the floor of the cranial cavity. So what we have here is, again, we have our bones in blue that you should be able to identify, right? The frontal bone. This gives you orientation, so you know this is the front. We'd have our face up here. The occipital bone is back here, so you know this is the back. So now from this view, I want to talk about two bones, the ethmoid and sphenoid. The sphenoid is this pink color, and your book does a good job of maintaining the color coding throughout. So the sphenoid bone to me is shaped kind of like a bat or a butterfly, okay, when we look at it from this view. And remember, we also could see it here when we're looking in the orbitals. That's because this kind of makes up the floor of the cranial cavity. Okay, so we can see it here. And then the ethmoid bone is this brown bone right in here, so much smaller. And so there's a couple bone markings from this area. We're going to start on the ethmoid bone. So right in the middle of the ethmoid bone, there is sort of this ridge, this projection that sticks up. And that ridge right in the middle is called the crista galli. I'll show you on an actual skull. Okay, so you can see that ridge right in the middle that sticks up, crista galli. The reason we have this is because coming off of your brain, you have a lot of nerves that supply your head and your face. And the very first nerve that comes off your brain is called the olfactory nerve. Based on the name of that, you should kind of figure out what it does. It is there for olfaction or the sense of smell. So this nerve, all your cranial nerves are paired. You have one on the right, one on the left. So this nerve kind of comes up and it sits on the right and left. And this crista galli actually separates those two nerves. It keeps the right and the left separate from each other. Now you also have this plate down here next to the crista galli called the cribriform plate. Cribriform plate. That's what the nerve, the olfactory nerve, is sitting on. It's sitting on the cribriform plate. Okay. Now if you look at the cribriform plate, you see all those little holes in there? Those are called, now your book calls them cribriform foramina. I call them olfactory foramina. Remember, foramen's a hole. Foramina is plural, it's holes. So the olfactory foramina are little holes in the cribriform plate that allow little nerve roots to penetrate down through the bone and into the nasal cavity. Because what is sitting right underneath here is the nasal cavity. And so this allows you to pick up the sense of smell. Now back here in the sphenoid bone, you have another bone marking that I highlighted. And this bone marking, to me, it looks sort of like a saddle, like a horse saddle. And we call it the sella turcica. The sella turcica. This is here because the pituitary gland actually sits in the sella turcica. Your pituitary gland is super important. It is a gland that releases a huge number of hormones in your body. And so it is nice and protected by bone. It's basically surrounded by bone as it sits in the sella turcica. Okay. Everybody okay on the skull marking so far? So we also have, this is a couple pages later. This is on in the physical textbook. It's on page 213. This is looking at an orbital, so just the eye socket. And you can see from the orbital, you can see the bones really well in the orbital. And I like to show this picture because I know you've looked at these, right? If we skip back to the beginning, we looked at all of these bones right here. All we're doing is just blowing this area up so we can see it a little bit bigger. And I like to do that because these bones, as we transition into the orbital, they change very quickly. So again, if you start in the middle, we have our nasal, then our maxilla bone in this lighter purple, and then we have our lacrimal bone in green, and then the ethmoid bone in orange. And then the sphenoid bone is in the back in this bright pink. And so I have a saying that will help you remember these bones and how they transition in the orbital. Okay. And so the saying for these bones in the orbitals is never make lily eat spinach. And this one makes way more sense than Jclo. The first letter of each of these represents the first letter of the name of the bone. I never make lily eat spinach. And so again, you know, if you are looking at your orbital bones, never is nasal, make, maxilla, lacrimal, lily, eat, ethmoid, and then spinach, sphenoid. Okay, so hopefully that'll help in terms of identifying those bones. Okay, so that is it for our skull bones. Now, there is also in your lab PDF document, there is an image of a fetal skull. And so this is on page 246 of the physical textbook, if you want to skip over there. On page 246, it is 7.7 if you are in the e-text. So the fetal skull essentially is, it is just a miniature version of the adult skull. And so you'll notice when you look at this picture that all of these bones are the same bones that we find in the adult skull. Walking to the back of the room because I have an actual fetal skull I'll put under the document camera. So you can see like the frontal bone in the front in yellow. You can see your parietal bone. You can see the occipital bone and the temporal bone, right? So let's look at, so this is an actual fetal skull, so it is a real skull, okay? You can see it's very tiny. And again, it is essentially, so you can see it's very delicate, it's broken. But it is essentially the same thing as an adult skull, just much, much smaller. But there are some structures in a fetal skull that we do not see in an adult skull, okay? And those are called fontanelle. So I've highlighted those in yellow in your textbook, okay? And so you can see here that fontanelles are basically soft spots. So, you know, you've heard, you know, babies have soft spots. Now, the biggest, most prominent soft spot in a baby is this one right here. It's in the front. I know when my son was born, I breastfed him, and I could tell if it was time to, well, you can tell when you breastfeed when it's time to feed for a whole lot of reasons. But, you know, if he ever got sick or slightly dehydrated, his little soft spot would get sunken in. He was a bald baby. And so it would sink in. If he would cry, it would bulge out, and I could see his little heartbeat, right? I could see his pulse in his soft spot. And so the soft spot, and you can see from the skull, it is not, it's not a hole, it's not an opening. There is connective tissue here. It's pretty tough connective tissue, but it's not bone, okay? It is actually allowing these cranial bones to continue growing. And so it allows the skull to get bigger and bigger. Now, eventually they're gonna fuse together, and that soft spot goes away. So this one that I'm showing you, this is the biggest one. It's called the Anterior Fontanelle. And you'll see that from this image, you can see it. Again, you can tell this is the front because here's our frontal bone. So here's the Anterior Fontanelle. And notice that I drew a line here so you can see that it's also right here from this angle. Now we also have one in the back called the Posterior Fontanelle, okay, which again, if I rotate this and we look at it from the back, you can see the occipital bone, the parietal bones, and now you can see that posterior fontanelle. And then we also have some on the side. There's a sphenoid fontanelle. This is given the name because it sits right above that sphenoid bone. And a mastoid fontanelle. Again, given that name because it's right above the mastoid process. Okay, so you do need to know the fontanelles on a fetal skull. All right. So now we're gonna move into the vertebrae. So we're done with the skull. That by far takes up the most time. The rest of the.
Can you go back?
Yeah.
I was late on getting the page.
Which page?
246. I just need to highlight the bone marking.
Oh yeah, sure. There you go. So the skull takes up most of our time today. The rest of these bone markings will go pretty quickly as we go through them. And again, I'll give you ways to remember these because it is so much material.
I'm done.
Okay. All right. So now, I'm sorry I'm flipping all over the place. I'm just trying to keep us kind of consistent with the lab PDF. So we've done the skull. I'm flipping back now, and I'm on page 218 of the hardback book. It is section 7.2 in the e-text. So we're in the vertebral column. So the first thing that you need to be able to identify when you're looking at the whole vertebral column is type of vertebrae, right? And so I have them highlighted. I know it's probably hard to see the highlights here, but remember, we talked about this on Monday. We have cervical, thoracic, lumbar vertebrae. And then we have a sacrum, which is vertebrae that have fused together, and a coccyx. We have 7 cervical vertebrae, 12 thoracic vertebrae, and 5 lumbar vertebrae. Okay, so you need to be able to identify the vertebrae when they're stacked together like this. The other 2 markings that I highlighted here, one is the intervertebral disc. So that term, inter, means between the vertebrae. So the discs between the vertebrae. So you should know those. And then this one, the intervertebral foramen. You know foramen's a hole. Intervertebral means the hole between the vertebrae. Now, actually, you can only see these when you have more than one vertebrae stacked together. You can only see those holes when you have at least 2 vertebrae stacked on top of each other. So just to give you an example, right, if I pull up a vertebrae right here, okay, so when we look at it from the side, notice you don't see that hole. You don't see the intervertebral foramen. But if I take another vertebrae and stack it on top of it, well, now you can see that hole right there, the intervertebral foramen. This is allowing the spinal nerves to pass through, okay? So if I turn it this way, this big hole right here allows the spinal cord to go through. But the nerves have to be able to come out, and they're coming out through the intervertebral foramen. So pay attention to the name of these bone markings. So that's our vertebrae when they're all stacked together. So now I'm going to walk you through a couple of images of the vertebrae when they're on their own and some of the markings of the vertebrae. So I just flip to the next page. This is page 220. So this would be looking at a vertebrae. Let's see. Sorry for all the noise. I'm grabbing some vertebrae. Okay. So mine are all connected together, which, see if I can grab some that are not connected together. There we go. Hang on. Okay, I've got a few. So essentially what you're looking at, so here is a vertebrae all by itself, okay? Normally when you think of a vertebrae, like when you feel your back, right, you're feeling this big process sticking off the back. And so we're just looking at it from this angle. That's what this picture is. So the first thing I want to point out is this structure here called the body of the vertebrae. So the body of the vertebrae bears a lot of weight. So most of the weight is being bared right here on the body of the vertebrae. This is what the intervertebral disc will sit on top of. Now you also have this big hole in the middle. That's what your spinal cord runs through, called the vertebral foramen. Okay, don't confuse that with intervertebral foramen. Right? It's just vertebral foramen. Now, we also have back here, we have our spinous process sticking out the back. Again, if you feel your spine, you feel these little bumps, you're feeling the spinous process. And then we have some sticking off the sides called the transverse process. These are all here. Remember, you have a process, big projections are there because heavy muscles attach or you're forming a joint. These are not connecting to any other bone, right? These are sticking off the back of your body. So these are there for big, heavy muscles to attach. These are your back muscles. A lot of times are connecting here. This area right here, basically holding the spinous process onto everything else, that's called the lamina. And that one's kind of important. We'll talk more about this in chapter 8 when we do joints. But the lamina is there because, well, that's not why it's there, but you may have heard of something called a laminectomy. The term ectomy means removal of. A lot of times if somebody has pressure on the spinal cord, maybe they have a herniated disc or some like arthritis, sometimes they can actually go in and they'll remove the lamina. They'll shave it off. And by shaving off the lamina on one side, they're just alleviating the pressure. And so you don't have the pain anymore. So that's the lamina. And then the pedicle is this area right here. It's this area of bone that's connecting all of this onto the body of the vertebrae. Okay. The only other one I didn't point out is right here. This is called the superior articular process. If you think of the term articular, articulation, articulate, means to join, a joint. And so this is an area on the vertebrae where you are going to join this vertebrae to the one above it. So if we look here, I'll show you this one. You can see the superior articular process. I'm going to show it to you from this angle. It's right here. Okay. And put two vertebrae together and you can see where they join together, right? So here is the superior articular process. And notice when I put a vertebrae above it, notice what it's connecting on. It's connecting on that superior articular process. So it is there to form a joint, okay? Now on the very next page, I do want to walk through this with you. Normally for our vertebrae, we give them number names like C1 through C7, T1 through T12. For the vertebrae, we give our vertebrae, the first two vertebrae, not only do we call them C1 and C2, we actually give them names. So the very first vertebrae is this one. It's C1, but the name is Atlas. If you are at all familiar with Greek mythology, you know Atlas is the guy who was burdened with holding up the world. He had to hold the world on his back. And to me, this one makes sense, why we call C1 Atlas. Here is C1. And C1 connects to the skull. Remember at these occipital condyles, it's going to connect right there. And its job, turn it to the side so you can see better, is to hold up the world, right? It's holding up the skull. So that's why we call that one Atlas. C2, we call this one Axis. Again, I always think of rotating around an axis. Let me see if I can find this one in my box of bones. I don't see it, but I might have it here. All right, so C1 looks a little different. We'll stay up here with C1. This one looks a little different from a couple of aspects. So it's missing some things, right? It's missing a spinous process, doesn't really have one. The other thing that it's missing, kind of try to get them both in the same picture, it's missing a big body, right? Notice C1 does not have a body of a vertebrae. And so C1 is pretty easy to identify because of that. Now C2, we call Axis, and this one does have a body, right? It has a body, it does have a spinous process, but this one has something extra that no other vertebrae has. It has a projection coming off the body called the dens. And so I'll show you, this is C2, this is Axis, but if I turn it to the side, do you see this big projection? That's the dens. Right? No other vertebrae has this huge projection. The reason we call this Axis is because it sits right below C1 and it allows C1 to rotate side to side. So you can turn your head side to side. So I always remember you rotate around the axis, right? So C1 is Atlas, holding up the world. C2 is Axis, because you can rotate around the axis. All right, I just turned to the page. So now we're on page 223 of the textbook. And this one is just, this image is just showing you the different types of vertebrae. So cervical, thoracic, and lumbar. And they look a little different. It is important that you could tell the difference between a cervical vertebrae by itself, a thoracic vertebrae, and a lumbar vertebrae. So I'm going to give you some very easy ways to tell the difference. Cervical vertebrae are the only vertebrae that have 3 holes. There are no other vertebrae that have those 3 holes. right? They all have a vertebral foramen. They all have this one. But cervical vertebrae are the only ones that have transverse foramen. So they have 3 holes. So if you see a vertebrae with 3 holes, like even this one, right, C1, notice it has those 3 holes. And this one, okay, notice it has those 3 holes. And you know it's cervical. Also, cervical vertebrae are typically small because they're not bearing a lot of weight. These are also vertebrae that tend to fracture easier because they are small. Thoracic vertebrae. Thoracic vertebrae are a little bit bigger. Notice, now this is a plastic vertebrae. This is a hole because it was in a model, so it had a rod running through it. So ignore that. It only has that 1 hole, right? The vertebral foramen. Thoracic vertebrae, to be able to identify thoracic vertebrae, I think if you look at it from the side, if I rotate this one to the side, it looks kind of like a giraffe from the side. Like it's got its little ears right here. It's got its little ears, little horns right on top, its snout. So it looks kind of like a giraffe from the side. And then the lumbar vertebrae, this is the biggest. And that's because lumbar vertebrae bear the most weight. So you'll notice here is a lumbar vertebrae and here is a thoracic vertebrae. So you can see how much bigger this lumbar vertebrae is. It is really huge, this one. And lumbar vertebrae, to me, from the side, when I look at this from the side, it looks like a moose, right? It's got these big old like antlers and the big nose. So it looks kind of like a moose from the side. So lumbar vertebrae are a little easier to identify from the side. They're just really big. Now, a lot of these structures we've already talked about. The one that we did not talk about is on the thoracic vertebrae. The thoracic vertebrae has something called the inferior and superior costal facet. So costal means rib. And remember, we have 12 ribs. We have 12 thoracic vertebrae. So your thoracic vertebrae actually have a place on them where the ribs can sit. So they connect in the back to the thoracic vertebrae. All right, so we're going to move into the image here on page 225. So this is the vertebrae, the ribs, and the sternum. So remember, we talked about this in the lecture on Monday. You have 12 ribs. The first 7 ribs are called true ribs. They connect directly to the sternum with cartilage. Ribs 8, 9, and 10 are called false ribs. And false ribs, ribs 8, 9, and 10, these ribs, notice that the cartilage, it sort of, I'll draw on mine, 8, 9, and 10. No. Not this one. So these last 3 right here, notice that the cartilage all fuses together before it makes its way up to the sternum. So those are ribs 8, 9, and 10. And then these last 2 ribs down here are floating ribs. Notice there's no cartilage connecting them up to the sternum. Now, I do have a sternum here, so we can look at this. Now, again, this is just showing you the bone in the front, but you can see the cartilage, which makes it a little bit easier. So we can count down to 7. 1, 2, 3, 4, 5, 6, 7. Those would all be true ribs. They all connect directly to the sternum. But then notice right here, 8, 9, and 10. See how this cartilage all fuses right here before it makes its way up to the sternum? That's why we call those false ribs. And then there is no cartilage here for ribs 11 and 12. Those are floating. Now the bones in the middle, we have our manubrium. It's here. The body is here. and then the xiphoid process is this dagger-shaped bone down at the bottom. If you've ever taken a CPR class, they'll tell you to feel up the rib cage, and then you should feel a little knot right here. That knot is the xiphoid process. So you could probably feel this on yourself. On me, it's located sort of right below where my bra sits. And so they tell you put your finger on this little notch, this xiphoid process, and then you would put your palm above that to do compression, right? And the reason is they want you doing compressions on the body of the sternum. If you do that, because that sits on top of the heart, that's where it's most effective. If you do compressions too low, not only are they not effective, but you can break off the xiphoid process and it can puncture the diaphragm. So you don't want to do that. The only other marking here is this jugular notch at the top. You can feel this on yourself. It is just sort of that, it's where the bone kind of ends, right at the top. Okay. All right, so now we're going to move into our appendicular skeleton. So we'll do our shoulders, our arms, our hips, and our legs. So the shoulders are two bones. Remember the clavicle and the scapula. So we'll start with the clavicle. This one is pretty easy. There's only two bone markings here. We grab a clavicle. Okay, so here is an actual clavicle. And so the two bone markings are the sternal end and the acromial end. Those are the bone markings you need to know. So if you look at this clavicle, the sternal end is really big. You can see it's kind of bulbous, whereas the other end is more flat, right? So the sternal end is the big bulbous end. This is the end that obviously is going to connect to the sternum. The acromial end is going to come out and connect sort of at the end of your shoulder, and it's going to connect to the scapula. So now let's look at the scapula. So if we look at the scapula from, here is the actual plastic model of the scapula, okay? And if we look at this, one of the things you're going to see is the spine of the scapula, right? That is the structure right here. It is here. You can feel this on your back. If you kind of feel your shoulder, you'll feel like your shoulder blade. That's your spine of the scapula. And it is here. Remember, projections are there because you're forming a joint or muscles. Big back muscles actually sit right in here and connect to the spine. Okay, so that's why you have a spine. And if you follow the spine all the way to the end, right, all the way to the end, you have this projection called the acromion. This is why we call this the acromial end. It's because it's going to connect to the acromion, okay? Now we also have something called the Coronoid Process, which here's the acromion, right, connected to that spine. Coronoid Process is right behind it. This is what a lot of your arm muscles will connect to, like your bicep will connect up here to the Coronoid Process. You have a notch at the top called the suprascapular notch. It lets nerves down into your arm. And then you also have these fossas that let big muscles sit in here. You have a supraspinous fossa. Notice it has spine in the name because it's above the spine. You have an infraspinous fossa, again, has spine in the name. And then if we were to flip the scapula over, right, if we take it and flip it this way, look at it from the underside, you can see there's also a groove in here, a divot. That's called the subscapular fossa. Again, notice the name. Sub means under the scapula. So notice there's no spine in the name of this one because it's not below the spine. It's on the other side of the scapula. The glenoid cavity is sort of this indent. I'll show it to you on this actual scapula. It's this right here. This is actually allowing the head of the humerus to connect. So this is giving you a ball and socket joint. Okay. Now you can see it down here. I didn't highlight this. I'm not going to put a picture of this, but you can see that glenoid cavity a little bit better down here. Okay, so now we're going to move to the humerus, which is just on the next page, page 230. The humerus is the sole bone of the brachial region, so the sole bone, sorry, of your upper arm. And there's some bone markings here that you need to know. And a lot of these bone markings have medial and lateral in the name, right? You can see these down here. And so it's very important that you can tell when you look at this bone whether it's medial or lateral, what side is what. The easiest way to do this is to find the ball. So the head of the humerus is the ball. That side's medial. That should make sense because that is what's going to connect, right, and make up the shoulder joint. So that's always going to be more medial. It's going to be towards the midline, whereas everything on the other side of that ball is going to be more lateral. Okay, so look for the ball, and now you know that whole side of the bone is the medial side. Okay, so here's the head of the humerus. All they've done here, this is the right humerus, and all they've done is just flipped it. They have the same bone, they just flipped it. So we also have right on the other side of the head of the humerus, you have these two big bumps. You have what's called a greater tubercle and a lesser tubercle. These are there for muscle attachment, like the tricep. We also have a marking right in the middle called the deltoid tuberosity. Again, this is here because it allows a muscle to connect, and the muscle is the deltoid muscle. The deltoid muscle is that triangle-shaped shoulder muscle that you have. If we move towards the distal epiphyses of the bones down here, again, this is where medial and lateral come into play. The side that the head is on, right, the side of the medial. So you have a medial epicondyle, right? It's on the side of the head. Now, I told you the term condyle means it comes in contact. Epicondyle does not come in contact. Epicondyle means it's off to the side. It's above a condyle, right? Epi is above. So the medial epicondyle and then a lateral epicondyle. You also have, down here, you have these big fossa. On one side, you have a really big one called the olecranon fossa. You can see how big it is. If you flip the bone over, on the other side, it's much smaller, called the Coronoid Process. How I remember those is I think, oh my gosh, that's a big fossa. That's the Lacrimal Fossa. I know that's weird. That's how I remember it. I think, oh, that's big, Lacrimal. Now you also have kind of this little bar of bone at the bottom. You can see it sort of looks like an hourglass that has set on its side. See it here. You can also see it over here. That's called the trochlea. And next to the trochlea, you have this big round structure. It looks like a C, so remember C for capitulum. Now, all of these terms we're going to use again, okay, on the next page. Okay, so I'm going to flip you to this page, and we're going to move down the arm into the antebrachial region, right, which again, remember, is the forearm. And there are two bones in your forearm. There is the radius and the ulna. The radius is this bone here. It looks like the top of it looks like the head of a nail. And the ulna looks more like a crescent wrench. Okay, so here is a radius. You can see the top of that radius. Yeah, it looks like the head of a nail. And the ulna, again, to me, it looks like a crescent wrench, right? Some of my students say they remember because if you set it on its side, it makes a U. So U for ulna, right? Now, the ulna is really big up here at the top, and it gets much smaller at towards the wrist. So we say the ulna makes up most of your elbow joint, okay? And the ulna is actually going to connect with the humerus, right? And it allows you to bend your elbow. I have a right and a left bone. They don't fit together very well. So let's go over the markings on the ulna first. So this, at the top of the ear, we call that the olecranon. Now, that, again, I told you you're going to see a lot of these terms again. Remember, we have an olecranon fossa, the big one. So the olecranon of the ulna sits into the olecranon fossa. Okay, they're named for each other. If you come around the C, sort of the inside part of the C is called the trochlear notch. Again, remember, this bar of bone down here on the humerus is called the trochlea. And so you can see that the trochlear notch, which is sort of this inside part right in here, rotates around the trochlea. And then lastly, we have this coronoid process. In the coronoid process, you can see as your elbow bends, as you bend that elbow, you can see that the coronoid process here connects into that coronoid fossa. Okay? So those are all named for the markings on the humerus. They're named after each other. So it makes it a little bit easier. Now, one other structure I want to point out, and this causes students a lot of problems. It's on the ulna. On the ulna, there is a notch cut out for the ulna for the radius to sit in. And so I don't know if y'all can see this on my bone very well, but it's really flat right here at the top, right? See how it's real flat? That actually allows the head of the radius to just sit right in there. Why this is confusing is because we call this the radial notch. Right? It's a notch for the radius, but this bone is the ulna. Okay, so that is the radial notch. So now let's do a radius. There's only like 2 markings on the radius that you need to know, or 3 of them. The first one is the head of the radius. I did it over here, but not here. Okay, so the head of the radius is just that, looks like the head of a nail. And then there's a little bump below that called the radial tuberosity. This is allowing muscles to connect. And then as you move down the radius towards the wrist, it gets a lot fatter. So your radius, remember, makes up the majority of your wrist joint, whereas the ulna makes up the majority of your elbow joint. So as you get down towards the bottom of the radius, it gets fatter. And just like on the ulna, there is a notch cut out on the radius. And again, I don't know if you can see, I'm down at the bottom of the radius. You can see this notch right here. This is a notch for the ulna to sit in, right? So it can sit right in there. And so that's called the ulnar notch of the radius. Okay, it's a notch for the ulna. So those notches sometimes can get a little complicated for students. All right, and then the last part of our arms that we're going to walk through before we do our hips and legs are just the hands. I'm just going to walk you through quickly. Notice everything is a bone. Everything's in blue. There are no bone markings here. But remember, you have 37 bones in your arm, in your entire upper limb. 1 for your brachial region, 2 for the antebrachial region, 34 in the hands. So that's a lot down here. So the first thing I'll point out are the phalanges, right? These are your fingers. So you have a proximal, a middle, and a distal phalange. Again, remember those terms. Proximal is closer to your shoulder. Distal is farther from the shoulder. Then you also have these long bones in here that are called metacarpals. These are the bones that you find right in here in your palm. Now, all of these bones, your metacarpals and all your phalanges, even the distal phalange, these are all long bones. They are longer than they are wide. All of these carpal bones down here, these are all short bones. They are cube-shaped bones, and there are a lot of them, okay? So I'm going to walk through them just so I can pronounce them for you. So we are going to look at these from an anterior view. So this would be like an anatomical position. This is the right hand. So this image right here is the right hand this way. Okay, so we're going to do these in anatomical view, right? So this is from the front. And so as we move out, you know, this is your thumb. So this is your pinky. So we're going to move from pinky over towards thumb, right? So we're going to start here. This very first one is called the hamate. Next to that is capitate. Then there's trapezoid and trapezium. Now we're going to go to the ones underneath. Again, we're going to start by the pinky. We have our pisiform, trachetrium, lunate, and scaphoid. Okay, so those are all of our carpal bones. And those, I don't have a saying to help you remember those. You just have to remember. You just have to memorize them. Okay, so now we're going to move down into our hips, and we'll do our hips and our legs. So this is showing you the entire pelvis put together. Again, you can see that in the back, the pelvis articulates with the sacrum. So right here, we say that that is the sacroiliac joint, where the iliac and the sacrum come together. If you look here, this ridge of bone around the outside, that's called the iliac crest. Again, if you put your hands on your hips, you're putting your hands on your iliac crest. The bones that you should be familiar with, you have an ilium, you have a pubis bone, and you have an ischium. Now notice how I just showed you these. Ilium is this big paddle-shaped bone in the back. The pubis bone, typically your pubis bone is just on the top part and comes down just a little bit right here. So all of that is your pubis bone. Everything on the underside is the ischium. In the middle, where your two pubis bones connect to each other, that's called the pubic symphysis. This is actually a bar of fibrocartilage. It is there so that there is a little bit of movement right here in this joint when you walk and move and run. But when you're pregnant, your body will release a hormone to soften this cartilage up, and it allows those two pelvic bones to actually separate from each other a little more to widen the birth canal. So you probably heard of women after they have a baby. I don't know if y'all have heard of this. Some women will put on girdles after they've delivered a baby, and they get them really tight. And what they're trying to do is actually reshape their pelvis a little bit because all that cartilage has gotten loose. If you put on a girdle after you've had a baby, you can actually make your hips a little smaller than they were before. I'm not advocating that. I'm just saying that is like a trend. There are women that do that. You also have this marking here, the acetabulum, which is essentially the big socket that the femur is going to sit in. Now, if we look down here, these are some of the same markings, but in this case, we can see them from one pelvic bone or the other. So let me grab a pelvic bone. Okay, so this is what one looks like, you know, when it's by itself and it's not color-coded. So this big paddle-shaped bone at the top, again, that is the ilium. And the iliac crest is just the hip bone. Okay, iliac crest. The acetabulum is the socket that the head of the femur sits in. We also have the bones color-coded down here. So you have the pubis and the ischium. How you can tell the difference between the two if it's not color-coded, so you can see this notch in the back. It's called the greater sciatic notch. Lets the sciatic nerve run down your legs. The pubis bone is always on the opposite side of the greater sciatic notch. And you can see the same thing when we flip the bone around. Here's the greater sciatic notch. Pubis bone is on the opposite side. Okay, the ischium, that bone is on the same side as the notch. Ischial tuberosity is basically what you would sit on. So if you have a bony butt, you'll feel that. And the big hole in the middle is called the obturator foramen. So those are the markings on the pelvis. Okay, and we're going to skip over and do the femur. So this is on page 240. So for the femur, this is the longest biggest, strongest bone in the body. I can put a little bit of it under here, but you can see it's a really big bone, okay? We know that this end is always up. This is going to make up your hip joint. Okay, now I told you on Monday, a broken hip is actually not a break in this bone. It is not a break in your os coxae. It's actually a break in the neck of the femur, which is this part right here. So the femur basically sits into the acetabulum and creates this ball and socket joint. So you have a great range of motion. So the markings here, you have a head of the femur. Now again, you have a head. Everything on the same side of that head is medial, because remember, this is always going to sit into that socket. Okay, so now that you know that, that should make things easier. Just on the back of the head, you have a greater and a lesser trochanter. These are projections that are there because of your gluteal muscles. Those connect and they allow you to raise your leg to the back. Down here at the distal epiphyses where you form your knee, you have a medial and a lateral condyle. Again, medial is on the same side as the head. Condyles come in contact. So these are going to come in contact. Okay, our condyles, which we can see right here and right here. We have a medial and a lateral condyle. They're going to come in contact with the bone below them. Okay, they form a joint. And then we also have a patellar surface. The patellar surface is what your kneecap sits on, which we call the patella. So we can see that really well. If I flip the bone around on the back side, notice it's like a big divot. That's the back of your knee. Okay, so the patellar surface is this flat part. Now the two bones that are down in your leg are the tibia, which is the big one. I just moved to page 242. Tibia and fibula. So the tibia is the second strongest bone in the body. Weight's going to go from the femur down through the tibia. And the tibia also has some bone markings on it that you need to note. Notice there's a lot of medials and laterals in the name. Unfortunately for this, there is no head on the tibia. So identifying the medial side, can't use the head. Instead, you're actually going to use down here the distal epiphyses. And there is a little projection that sticks off called the medial malleolus. That is, if you feel your ankle, if you feel the inside of your ankle, you feel that knot on the inside, that's the medial malleolus. So now if you find that, you know that whole side of the bone is medial. So I have a left bone, so mine's on the other side, but here's the medial malleolus on this one, right? You can see it, it's really easy to identify. So now I know, okay, on this bone, this whole side is medial. Okay, so on this image, here's the medial malleolus. All of that's the medial side. So if we come back to the top, we know we have a medial condyle and a lateral condyle. And again, those are just going to line up with the medial and lateral condyle of the femur. Okay, they come in contact. Now we also have in the front, we have something called the tibial tuberosity. This is actually going to be connecting some of your big leg muscles, your thigh muscles will connect down here. So that's why you have that big muscle connecting. The little bone on the side, this is the fibula. The other way you can tell, again, I'm going to use this image for your test and for your quiz. So the other way you can tell medial from lateral is the fibula is always lateral. It is always on the outside. Okay? So the fibula is always lateral. And the fibula only has two markings. It has a head of the fibula, and then down at the bottom by the ankle, it has the lateral malleolus. So again, if you feel your ankle, you'll feel the malleolus on the inside. That's the medial malleolus. And then you'll feel the malleolus on the outside. That's the lateral malleolus. Okay, and then the very last thing we're going to go over today are the feet. So just like we had in the hands, again, we have all of these long bones. Again, instead of calling these carpals, they're tarsals. So we have metatarsal, and then we have our phalanges. Again, proximal, middle, and distal. And then our tarsals down here, these are, again, short bones. The only short bones in the body are your carpals and your tarsals. Okay, so your tarsal, let's go through these. You are looking at this foot. This is the big toe. Okay, this is your pinky toe. So we're going to start here from the big toe. This little short bone is called the medial cuneiform. Next to that is the intermediate cuneiform, and then a lateral. So those are pretty easy, medial, intermediate, lateral cuneiform. On the outside here by your pinky is called the cuboid. Okay, this one here is the navicular. And then the last two bones are the talus and the calcaneus. So I'm going to show you a foot really quickly. Okay, the same right foot. Okay, and so I'm just going to show you these two. The talus is this one. I'm showing you this one because I have the wrong bone. Hang on. There we go. I'm showing you the talus because remember how your weight is distributed is it comes down the femur, down, here's our tibia, down the tibia, and then from there, I have the right bone. Hang on. No, I have two of the wrong bones. Well, that's not helpful. All right. And then from there, it is going to connect onto that talus. And notice how the tibia and the talus connect to each other. It allows that foot to point and flex. Okay. So the weight's going to come from the tibia down through the talus. And then from there, it's going to move through this huge short bone down here at the bottom, and that's your heel bone called the calcaneus. All right, so we just went through all of your bones and your bone markings. I am going to show you, I'm going to see if I can swap my camera real quick. Again, study the images that are in the textbook that we just went over. I'm going to share my screen, and I'm going to pull up mastering. Oh, y'all can't see my screen, can you?
Yes, please.
You can?
Yes.
Not the, you can you see mastering right now?
Yes.
Yes.
Oh, okay, well, great. That is not what I see, but good. Okay, so in mastering A&P, if you go to the study area, I'm just going to show you just a great way to study some of these bones and bone markings. There is something called PAL, Practice Anatomy Lab, and if you click on it, you can open that. And so you can actually see the Practice Anatomy Lab. And so this is a human cadaver. And so you can also do models. And you can do, let's see, the skeleton. So we say, okay, let's do the axial skeleton. I want to do the skull. And here is an image of the skull. And this one is, you can see just self-review up here. So this one, if you just kind of scroll and use your mouse, it'll tell you what the names of these bones are, okay? So that one's kind of helpful. But you can also do a quiz or even a lab practical. And the lab practical is very similar to what I would do for your lab quiz and your lab exam. So this one has something highlighted and it says, identify the structure. So I would say, okay, that's the ethmoid bone. Okay, and then go to the next one. So this one's pretty cool. It's just asking you to identify. So you can quiz. I think a quiz is multiple choice. So you can quiz yourself, but remember, Your quiz and your lab exam are not multiple choice. You have to type the answer in. So I like the lab practical a little bit better. So you can do that for the axial skeleton, the skull, vertebrae, rib cage, and the appendicular skeleton. So this is a pretty helpful resource, especially for the lab. So just don't forget that you have that. There's also, if I go back here, there's also flashcards, PAL flashcards that you can use. I will tell you, I'm going to stop my share there. I will tell you that I think the best way to study this, when you have a lab PDF that you're working on this week, what I would do as a student is you have gone through this with me and you have highlighted with me. So now get some Post-it notes and cover over all of the terms, right? Now they're covered over, but you can still see the leader line. So you'd say, okay, that's the distal phalange. That is the middle phalange, and that is the proximal phalange, right? So now you are, from recall, you are identifying these bones and bone markings. So I think that is really helpful. It is not helpful if you are constantly looking at the term and then pointing at it. Because remember, how you're tested is the opposite way. I'm showing you this, and you got to tell me the term. You've got to bring it back from recall, okay? So if you've got some Post-it notes and you can cover over things and recall from memory, you are good to go, all right? I will say, again, this is the hardest lab of the semester. You know, even in the face-to-face class, this lab is probably more difficult because you're not looking at pictures in the face-to-face class for your exam. You're looking at the actual bones. So you have a slight advantage taking this online in that you're just doing pictures. So this is not something that you can learn at the last minute. You are going to have to study a little bit every day and really memorize these structures. And this is straight up memorization, okay? I tried to give you some tricks to remember some of these, so hopefully that's helpful. As you're studying, if you've got questions and you need help, let me know. This hopefully will get you through your lab PDF and make it a little bit easier to do that PDF. Everything that's highlighted is what's in the PDF document, okay? Does anyone have any questions? Everybody okay?
Yes.
Okay, all right, guys. Well, I will see you again next Monday.
Thank you.